Right, this is part 6 of the Integumentary System. We are going to be taking a look at pathologies, specifically cancer and burns. So, skin cancers typically are, not that one's better than the other. Most of the skin cancers are the safest type to get. I think that would be the better way to put it, because most of them are benign. And even if they are cancerous, they are typically slow growing. And just in case metastasis, if something metastasizes, I think we all know this, but just in case, that is just the way it spreads. So the three major types are going to be a basal cell carcinoma, squamosal cell carcinoma, and a melanoma. And so we're going to take a look at each of these. And if you think about what cancer is, runaway cell division, these are going to arise in layers of the epidermis where they are mitotically active. So a basal cell carcinoma is going to occur in the stratum basale, because that's where the cells are actively dividing. And it is pretty slow growing, typically does not metastasize. Thankfully, this is the most common, and so it's also the least malignant, so that's why it's good news. Squamous cell carcinoma, these are keratinocytes of the stratum spinosum. Some of them will still go through division in that layer. Typically where we're going to see it, scalp, ears, lower lip, areas that are going to be involved with exposure to sunlight. So this can grow rapidly. It will metastasize if it's not removed. However, survival rate for this type of skin cancer is extremely high, just because it's typically noticeable that there is some sort of growth in those areas, ear, scalp, lower lip. Now, there are cases where people have passed away from this, but typically what it is that we see that the patients, in my pathology class, we came across someone who was over in Iraq after the first Iraq war as a contractor, and he got a squamous cell carcinoma on his scalp, but he never did anything about it. So it almost took over his entire scalp, and then he did pass away because it metastasized. And you will come across that with patients. So that's kind of just an FYI. By far, the worst skin cancer, and in some cases, the worst cancer to get, is a melanoma. So this is cancer of the melanocytes. This is easily the most dangerous, at least in terms of the skin cancers, because it is highly metastatic and it's resistant to chemotherapy. There are some new treatments that are being tested and some new detection methods that are being tested. Right now, there is a detection method, just a visual inspection. So that's what we're going to cover. You are not responsible for this. I am not going to test you on this, but because these melanomas are so aggressive and so dangerous, really what we see is that surgery is the only chance, and you'll see that there'll be this tiny area where that melanoma is, and they are typically with surgery really generous in removing, because they just want to make sure they get 100% of it, because it's resistant to chemotherapy. There really isn't an adequate follow-up treatment. So these are the ABCD rule, and this is, again, FYI, not going to test you on them. So typically, if we're taking a look at a pigmented area, if it's asymmetrical, an irregular border, has color, and has a large diameter. A new one has been added, and again, FYI, it's E for elevation. And if it's elevated, I don't know the exact measurement, but I think if it's elevated 2 millimeters, don't hold me to that. But again, FYI. So the last type of pathology that we're going to cover are going to be burns. And I will tell you from people that I met that continued on in medical school, they have told me, I don't have any firsthand knowledge of this, is that coming across burn patients, that was the hardest thing that they had to deal with. So burns, there are, I think everyone knows this, different degrees: first degree, second degree, third degree, and they are categorized based on the damage. So first degree, only the epidermis is damaged, so we're talking redness, swelling, pain, so typical sunburn. Second degree, epidermis and the upper regions of the dermis are damaged. It's the same exact symptoms as first degree, but now we see blisters. Third degree is the worst. So the entire skin is damaged. You really can't quantify it based on the color of the burn because it has so many different colors, and there is no initial edema or pain. Now, typically, if you have, if this is an arm and here are third degree burns, it's very common to see then second degree burns and first degree burns as you go away. So there will be pain, but in the area where there's that third degree, there typically is no pain at first. Unfortunately, that doesn't stay that way, but the nerve endings are destroyed. So if a patient comes in that has burns, the amount of protein synthesis that this patient is going to have to go through, it is impossible to be able to expect, particularly a person who's burned, to be able to consume that many calories. So this is where it becomes critical to be able to have a rough idea of the percentage of these burns in order to properly treat that area. So what is used is a rule of nines, and it estimates the severity of the burns, and it is considered critical if these following things are, if it's 25% is second degree, 10% is third degree, or there are third degree burns on the face, hands, or feet. This part is FYI. All right, so I'm not going to test you on this, but I do want you to know the rule of nines. And what the rule of nines does is it just breaks up the body into these different areas that are multiples of 9. And so that they can take a look, and if just say the front of one leg is burnt and the entire leg, then they say 9%. And then they can come up with these approximate percentages, and then that also guides their treatment in terms of what type of caloric intake that patient is going to need, how many antibiotics, those sorts of things. All right, so that's it for the burns. I'm not going to test you on the individual percentages. Just want you to know what that rule of nines is and how it came to be rule of nines. That's all. So only two other things that I want to talk about. So the first that we have is lanugo. It's delicate hairs that cover the fetus. And if you remember when we talked about seborrhea or cradle cap in infants, and I said it's because these sebaceous glands have to be overactive as a fetus. And so when that bundle of joy is delivered, it is covered with what's called vernix caseosa. And that literally means varnish of cheese. So it's just a substance produced by the sebaceous glands, and it protects the skin that is completely surrounded by that amniotic fluid. And that is why that cradle cap is so common. And that is it for the integumentary system.